and a hybrid with great insights into basic and clinical research. Dr. Sanjay Mittal is currently in charge of the heart failure program, non-invasive and clinical cardiology, as well as clinical research program at Medanta Medicity. He is also the director of Medanta Duke Research Institute. A recipient of many professional awards, Dr. Mittal has an avid interest in conducting research and writing papers. He has more than 50 publications in various national and international journals and textbooks. He has performed several clinical trials and has also made many of his papers published in peer-reviewed journals. We welcome you, Dr. Sanjay Mittal. Next up, we have Dr. A. Gopi, who is a senior interventional cardiologist and director of cardiac cath lab at Fortis Hospital, Bengaluru. Over the last 22 years, he has close to 20,000 diagnostic and 4,000 interventional procedures to his credit. He's a fellow of the Society for Cardiovascular Angiography and Intervention, USA, fellow of the American College of Cardiology, and the past president of Bangalore, Karnataka chapter of Cardiological Society of India. We are honored to have you here, Doctor. We welcome. Without much further ado, we will now move on to our questions and we take on to discussion topics on sudden heart attacks among youngsters. To begin with, I would request Dr. C.N. Manjunath to answer to this particular question. Doctor, has there been an increase in sudden heart attacks among youth recently, especially after the pandemic?
Actually, if you look at the scenario of cardiovascular disease, in particular heart attack in India, nearly 30% who suffer heart attack are below 40 years of age. So young Indians and middle-aged Indians are becoming vulnerable to heart attack. And particularly in the last 10 to 15 years, there is a surge of heart attack cases among the youngsters in India. So the most important thing, everybody is worried whether all of a sudden it increased post-COVID. I think answer is there is only a marginal increase in the prevalence of heart attack among the youngsters post-COVID, but it was very much there even much before COVID also. So in fact, 30% of deaths in India is due to cardiovascular disease alone. So in fact, there was a time children used to bring parents for the treatment of heart attack. Today, parents are bringing their children in the region of, in the age group of say 20 to 40. I think we lost.
No, doctor, we can hear you. You can discontinue. Yes, we can hear you.
So that scenario has changed. As I was telling, parents are bringing their children in the age group of 25 to 40 years for the treatment of heart attack. So it's a matter of concern for all of us. So cardiovascular disease is on rise. In our own data, in the last 5 years, we have treated close to 5,000 young heart attack patients falling in the category of below 40 years of age. And if you look at the risk factor profile of young heart attack patients, 51% in our study were smokers, and only 10 to 15% had high blood pressure, diabetes, and abnormal cholesterol level. And interestingly, another 16% had a strong family history of heart attack. Those family members, first degree relatives, or uncle, aunts, father, grandfather, or mother, if they have suffered from an heart attack below the age of 50, such family members are more prone for heart attack. So another thing that is really worrying us is among those who suffer heart attack in the young, nearly 30% will not have any conventional risk factors. No smoking, no diabetes, no high blood pressure, and cholesterol levels are normal. So this is where we are searching beyond conventional risk factors, whether any new emerging risk factors are there. Probably stress is one of the important risk factors. I think stress is considered to be a new tobacco. Stress is equivalent to smoking, because acute stress can precipitate heart attack and it can trigger heart attack. So stress is a very important thing. And of course, food habits have changed, food products have changed. and physical inactivity. These are some of the, even fatty liver today is considered to be one of the enhancing risk factors. So I think definitely one should not be under the impression there is the heart attack in the young is occurring only post-COVID. No, it was occurring well before COVID also. And in our own study in the last 10 years, if you look at our data, there is 22% increase in the prevalence of heart attack among the youngsters.
Okay, right, doctor. We understand that there was not a sudden heart attacks during the pandemic, but then what you had said that about various factors that are actually affecting this kind of a risk factors. To
But
come to
COVID,
yes,
COVID
yeah,
has contributed to a marginal increase in the occurrence of heart attack.
okay.
So,
This is
because
again
COVID,
with this is again with general public or with the youngsters, doc?
yeah, it is among general public, and
Okay,
youngsters also form the same part of the general group.
group.
Because
Okay,
COVID, as you know, it can always facilitate clot formation in the arteries. So if
okay,
the clots are formed in the arteries of the heart, it causes heart attack. If clots are formed in the brain, it causes stroke. If it is in the lungs, it causes pulmonary embolism. So
okay.
certainly COVID has contributed to a small percentage, enhancement.
A very small percentage. Okay. Thank you, Dr. Manjunath. I would come to Dr. Sanjay Mittal for the next question that we wanted to clarify. Dr. Mittal, preventing adverse cardiac complications was always about eating healthy and being physically active. Is there any specific precautions to be taken during the post-pandemic period of COVID?
Thanks for asking this question. Am I audible?
Yes, doctor. Can you be a little louder? Yeah.
Okay. So thanks for asking this question. The very fact Dr. Manjunath has clearly mentioned that myocardial infarction or heart attacks or sudden death in young is not an unknown phenomenon in our country. And it has increased over the last couple of years in the post-pandemic era. But that is a part of two things. One is a continuum of the process of increasing cardiovascular risk in even younger population. And also, as Dr. Manjunath did mention, that it is to some extent related to the inflammatory process of the COVID pandemic itself. There was a beautiful study in US where people who had COVID, even mild COVID, were followed up for an year. And they found that in people who had even mild COVID, the incidence of heart attacks actually increased by 60 to 70%. And people who, as compared to those who never had COVID. In general, the population increase was around 20% or so, that the COVID times have led to increase in incidence of hypertension, diabetes, and heart disease. The second point which I want to make here is that what we unfortunately today have a big misconception in the public is the cardiac event. And the cardiac event we talk as heart attack or whatever is the culmination of the problem, not the start of the problem. Usually the start of the problem acts actually decades before this actually results into a heart attack, small fat deposits in the arteries of the heart, which we commonly continue. And this is a slow growing process which happens over decades, not in days. And by the time we realize, it's usually too late. And this is why we say that a regular exercise program actually prevents you. It's not one-time exercise, a regular inculcating lifestyle change to inculcate exercise into a day-to-day visit is something which is very important. And diet also is something which has to be inculcated as a part of lifestyle. Why? Because just behaving yourself one day does not mean anything. You have to have years of good lifestyle which lead to a good state. In post-pandemic, as Dr. Manjunath was mentioning, the biggest thing which has influenced us all over the globe is the level of stress.
Okay.
Most of us actually have been in a huge bit of stress burden because of the financial reasons, because of occupational stresses, because of professional stresses, whatever the reasons may be, we do have a definite increase in the stress levels. And this also has contributed to increase in the incidence of heart attacks and sudden cardiac deaths into our situation. So
Okay.
one thing which I would like to say is we have to be cautious about today is to go continue the good regulated regular exercise program. It's not, as I in Hindi very commonly say, there's a balance between Josh and Hosh. So you have to actually be a balanced approach that you do a regular exercise within your desirable limits. Don't push yourself too hard that you are out of breath and you are panting for breath during the exercise program. Continue the good dietary habits because exercise and diet control also helps in the stress busting solution. Proper
Right.
sleep is something which has been now added as a big negative risk factor. Rather, improper sleep or disturbed
Lack of
sleep
sleep.
is a big risk factor in our scenario for development of early heart disease. So these
Right.
are important things. And besides this, there are one thing which I always say to my people is that there are three hidden silent killers in us. These three silent killers are hypertension, diabetes, and high cholesterol. We do not have any signs and symptoms of high cholesterol, and most of the times not even hypertension or diabetes. Until you get them checked, you can always miss them. So if a person has a very strong family history, it's always better to get themselves evaluated timely so that these devices, these silent killers can be controlled and the chances of heart disease can be mitigated. Not
Right.
the least, I would re-emphasize the fact that smoking or tobacco products in any way form are poisons. And if you give up
Right.
smoking today, you do not see that the effect of smoking has gone tomorrow. It takes 1 year for the effect of smoking to reduce by 50% and about
Okay.
10 years for the smoking effect to go back to non-smokers level. So this is something which we have to understand that smoking always is a promoter of plaque ruptures or sudden cardiac attack and cardiac irregularities and should be
Okay.
given up as soon as possible.
Right. I think that was a very in detail preventive measures, doctor. Doctor, can I also request you to please switch off the camera and switch it on again because we are not able to see your camera.
Okay.
We are still not able to get a view of you, doctor.
So what I'll do is by the time Dr.
Sure,
Gopi
sure.
is
Yes,
answering,
sure.
I'll
Definitely.
rejoin.
Yeah, definitely, definitely. Yeah. Moving on to the next question to Dr. Gopi. Doctor, most of the videos that seem to get circulated in social media and television channels seem to be about people suffering cardiac arrest. Though media generally calls it heart attack, does it mean that most of these people are had underlying or undetected cardiac conditions all this while?
Yeah, I do agree with you that the media sort of interchangeably uses the word cardiac arrest and a heart attack. Now,
Okay.
what we need to understand is cardiac arrest means that the heart is not able to pump blood at all. It is not at all functioning. It could be due to two reasons. Either the heart is completely stopped, or else the heart muscles are beating at a very rapid rate, 300 plus. So at which time there is not sufficient time for the heart to receive blood and pump it. So effectively there is no blood supply to the body. So this is what cardiac arrest is. Yes, but at
Yeah.
the same time we need to understand that heart attack is the most common cause of a cardiac arrest. Let us say almost 80% of the times cardiac arrest happens because of a heart attack. The other causes could be like, we can have a blood clot in the lung, like pulmonary embolism. We can have infections in the heart called myocarditis, aortic dissections, or aortic valve weakness. So these are the other multiple causes, though the most common cause is an heart attack. And heart attack happens when there is a disruption in the blood supply to the heart. The heart has got three tubes which supply blood to the heart. So a blood clot comes and forms on an underlying fat deposition. And once there is lack of blood supply to a particular portion of the heart, then it means that heart muscle is going to die, and as a result, heart function gets affected. Now, so when coming back to the question, patients who have cardiac arrest, generally almost all of them would have some underlying cause which is responsible for the cardiac arrest as such.
Right, doctor. with clearly with that particular notion that maybe there is an interchangeably of how people are using the terminologies, which might affect people's perception. Again, to come to the point of the other part of the question to Dr. C. N. Manjunath was, Doctor, do over-exertion and unsupervised workouts at gym contribute to heart attack risk?
Yeah, always exercise is an integral part of maintaining a good health, overall health, including heart health. But somebody is resorting to very high intensity, unaccustomed exercise. So always it will have a deleterious effect on the heart. That is the reason if somebody wants to take up an exercise program, because I will just give an example. If somebody is capable of lifting 25 kgs of weight, you should not try to lift a weight of say around 70 kgs and they will get into problem. So a moderate intensity exercise for a duration should be longer. Intensity should be moderate and duration should be longer. And they are the very good exercise. There are two types of exercise actually. One is what is called isotonic exercise, where there is a alternate relaxation and contraction of the muscle. And other is an isometric exercise, that is lifting weight or bending the bars and other things and all. So the best exercises for health promotion would be isotonic exercises such as walking, maybe swimming, cycling, jogging. In fact, there is a robust evidence that if you exercise for at least 45 minutes a day, it increases your lifespan by 7 to 10 years. So that's what, even just to put it humorously, heart also says, you just walk 1 hour for me, I will continue to beat for rest of your life. So
okay,
that is the reason exercise, high intensity exercise, sudden weight lifting, and all of a sudden, if you are not well trained in that exercise program, taking marathons, I mean, you're not used to those marathons, and sometimes these trucking people go without understanding the problem. But again, a word of caution, if you are taking up an high intensity exercise, before taking up that high intensity exercise program, most important, you should undergo a cardiac evaluation, because there can be a hidden cardiac problem. They should have an ECG, they should also have an echo, and also undergo a medical treadmill test that will tell us how far your heart can sustain, whether how your heart functions under a high level of stress. That is one thing. There is also, I think 1 in 500 or 1 in 1,000 population, there is an entity which comes by birth, what is called hypertrophic cardiomyopathy, where heart muscle is very thick, heart weight is more than the normal hearts, and such people are more prone for sudden cardiac death, such people. So even when you are doing a treadmill exercise at home, best is for first 3 to 6 minutes, you go for, medium speed and medium inclination, then you can gradually increase. So I think this is very important. You have to gradually increase the speed. Some people all of a sudden, first minute only, they increase the speed and they overexert. So overexertion is not good. That is the reason we have what is called warming up period. So whenever you are doing an exercise, you warm up for about 3 to 5 minutes, then gradually increase. So certainly high intensity exercise, that too, when you are not used to it, you should not take it up. But moderate intensity exercise is a must for a good heart health.
Right. Moderate exercise is good enough to heart health. Very rightly put, doctor, because there are two extremes of exercises that people keep trying to do. To moving on to Dr. Sanjay Mittal. Dr. Sanjay, should I come to you after you leave and join back, because we are still not able to see your video?
I think you can go ahead. I can
sure.
answer.
Sure. Yes, doctor. Doctor, so we just wanted to understand. So after Dr. Manjunath was talking about how moderately people need to exercise, we also come to this question of what are the precautions as a preventive cardiologist you see that especially for middle-aged people before hitting the gym, doctor?
Good.
Yeah.
This is an important question.
Yeah.
As I say, the middle age is vulnerable age. There is a certain kind of vulnerabilities I'm going to define in next few minutes. First is vulnerable people. The second thing is vulnerable age, and third is vulnerable stage. So the vulnerable people are those who actually belong to families who are having young heart attacks and heart disease. So in these people, you have early development of atherosclerosis, fat deposits in the arteries of the heart, and this can lead to a big problem suddenly. Secondly, there is a situation what we call as vulnerable age, and this middle age is the vulnerable age. Why? Because people do not have symptoms. And mind it, as I was mentioning in the previous communication, the heart arteries may block 70%, up to 70%, and yet there would be no symptoms. That means you can run a marathon even if you have a blockage of 50 to 60% in the arteries of the heart. But these fat deposits, one fine day, cause thrombosis or clot formation because of sudden spurt of blood supply. This spurt of blood supply can cause damage to these plaques and cause clot formation and sudden heart attacks. So this is why we have a vulnerable age, because these people have small blockages which are not critical enough to produce symptoms, but they go on exercising, and those exercise leads to certain spurt of blood and lead to damages. So what I give as a mantra to people who are middle aged is,
Yeah.
first understand yourself. Understand yourself means, do you belong to a vulnerable family? Do you belong to a vulnerable age? And if you do have vulnerable stage, it means comorbidities, diabetes, hypertension, or smoking, you should get yourself evaluated. Don't be foxed by the fact that you don't have any abnormality of symptoms, chest discomfort or anything. You may be harboring plaques there, which can rupture one fine day and cause problems. So that is point number one.
Yeah.
Point number two is that if you have a vulnerable stage or a vulnerable group, then you should get yourself evaluated for those vices, as I said, diabetes, hypertension, cholesterol. Third thing is that, as Dr. Manjunath also very, very clearly said, that the regularity of exercise is most important. It's not one-time exercise. So just like Dr. Manjunath was saying, 1 hour exercise a day, there is a different thought today that the daytime activity is better than one-time activity. So be actually intermittently getting up from the chair, moving around and do activities. This is something which is inculcated, and that is why the mantra of 10,000 steps a day was coined out, because this promote the fact that it is not important that you do one-time activity, but be active throughout the day, so that on the end of the day, you should clock nearing about 10,000 steps, as close to 10,000 steps as possible. The third thing is, as Dr. Manjunath said, the excessive exercise. So I would like to redefine that, because excessive exercise depends on the person's capacity and tolerance. If a person is a marathon runner on a regular basis, maybe running for 5-6 kilometers is fine with that person. So we have to understand what is right exercise for us. Respect our body, respect our system, and respect our symptoms. So what is the mantra is, if a person is exercising, the level of exercises which makes the person breathless, so that he cannot even speak a single sentence, is strenuous exercise for that person. So you should be exercising to the level that you are not so out of it that you can't communicate it. The breathlessness should be there. This level of moderate exercises. And this level of defined moderate exercise vary from person stage to person stage. And that is why we have to be watching. If I'm going to an exercise gym, we have to watch kind of exercise, as Dr. Manjunath said, plus watch what is moderate level for me, for you, for a person. So that may be different from one person to the other. So don't copycat the person who is next door exercising with you. You have to respect your body and exercise with your own capacities.
Okay. Okay, right, Doctor. Thank you so much for putting this in a very crisp and clear perspective that moderate exercise as well as getting up when you're sitting and working at the workplaces, getting up, moving, and making yourself active is really important. Thank you so much, Doctor. While Dr. C. N. Manjunath and Dr. Sanjay Mittal discusses about the exercises, workouts, and everything, the other part of the question that arises here, also would like to ask Dr. Gopi, Doctor, apart from exercise, apart from the prevention methodologies, are people with diabetes at a higher risk of suffering from cardiac arrest compared to those with or without diabetes, Doctor?
I think, yeah, the diabetes is considered to be one of the most important risk factors for all heart problems. And
Okay,
we know that in our country we are considered to be the diabetic capital of the world. So we have
right,
many diabetics at a much younger age. So that again coming into the main topic of heart attack in youngsters, diabetes has a major contribution to this. So it is thought that the incidence of heart problems is 2 to 4 times higher in diabetic patients as compared to non-diabetics. Now, why does this happen? Basically, we know that in diabetes, there is they're not able to control their blood sugars. The blood sugar is always high. So this results in damage to the blood vessels, especially the inner lining of the blood vessels.
right,
Not only that, it also changes the how the cholesterol levels. It causes some changes in the cholesterol that is circulating, which makes it more prone for these cholesterol particles to get deposited in the inner layers of the blood vessels. As a result, they get into a obstructive coronary artery disease. So with these factors, also there's a tendency that they have a higher amount of blood clot formation. So all these things increase their tendency to get a heart attack. And not
right.
only that, many times diabetes is not isolated in a patient. It
Yeah,
is
okay,
accompanied by other chronic illnesses. They tend to have hypertension, then they tend to have kidney problems. All
okay.
these things, exponentially sort of increase the incidence of heart diseases. So yes, coming to your question, direct answer, diabetes is a major risk factor and increase the incidence of heart diseases in the population.
Right, right. Thank you, doctor. Of course, when it comes to even people with diabetes, even in the youngsters, the population are growing. So, how do you relate that particular thing, doctor?
In the sense, see, diabetes we know is increasing because
Okay,
for some reason our country or our region is much high prone for diabetes. As I said, so diabetes is considered to be the diabetic capital of the world. So
yeah,
we have very young patients who come to us with diabetes. So
right.
whenever we diagnose diabetes, we label them that they're very high risk for heart problems. So we take all the precautions that we need to take in these patients. We start advising them, get them evaluated regularly, not only from the diabetes point of view, their occurrence of other chronic illnesses, so that we can try and prevent this from progressing on to something more serious, and before it affects the heart, we would like to take care of it.
Okay, okay, right, right. Thank you so much, doctor. Dr. Manjunath, to coming to the point that you had briefly told us or briefly gave us an account on how stress is the new smoking, and so to continue with that question a little deeper, doctor, is work-related stress a major contributor to the current increase in the heart complications, doctor?
See, stress actually is a hidden element that is
Yeah,
always lurking.
right.
So, see, today, stress starts from childhood itself. For
Okay,
example, children education today has become mother's examination. You just see stress is building up from a very young age. So you see, even kindergarten children, they are made to get up early morning, 5 o'clock, and they put them in the bus as if they are animals. And they are. So I think this is where the stress level builds up. See, as already Dr. Mitchell has said, so there will be a family stress. There will be you are worried about your future, particularly younger generation. What is happening? The real stress for the younger generation is they try to achieve too many things in a too short time. Suppose an achievement would have taken about 10 years. They want to achieve in 10 months. So that is putting an extra stress. So what is stress? Stress is nothing but a gap between your expectations and performance. So if your expectations are more than the performance, you will get into all stress problem. And another thing, our youngsters should also learn that they have to come up in life, whether academically or whether it is professionally, they have to come up stage by stage, step by step. So this is where their thought process has to change. And another important thing, the acute stress is also one of the important risk factor for heart attack. We have seen acute stress means sudden demises in the family, or
Okay.
sudden business losses, or you are expecting some promotions, or you are expecting some high profile job. It doesn't happen. So acute stress, that is what is called broken heart syndrome. See, there is an
Okay.
entity called broken heart syndrome. Any acute, I mean, sudden sad news or sudden unexpected bad events happening. We have seen patients, elder brother bringing younger brother for heart attack treatment. Ultimately, the one who has come for heart attack treatment has survived. The one who has escorted has died because of acute stress. So the stress, because stress increases your heart rate, stress increases your blood pressure, stress increases your various stress hormones, that causes vasoconstriction, we say. There is release of catecholamines, and that causes constriction of the blood vessels, and that can result in heart attack. So certainly stress is an important risk factor, unquestionably. And this is where for example, today, young and middle-aged women are becoming vulnerable to heart attack, which was rarity about 3-4 decades back. Today, women in the age group of 30 to 40, those who are working in ITBT or those who are working morning till midnight in various multinational companies. So for them, there are three, I think, particularly young women, maybe about 3 decades back, we were rarely seeing heart attack in young women in the age group of 30, 40. Today, around 8% of our data shows among the younger age group, 8% were women, 32-year-old executive we have seen, and 30-year-old even a slum dweller we are seeing, because they have a family stress, they have stress of children education, and plus they have to work also. So I think this is where, because always women feels they have to take care of their children and husband, but they, in their whole process, they forget their own health. So I think women also should become, because they are also working. Nowadays, there is a new entity or nomenclature called menish women. That means they're exactly working like men, but with lot of additional responsibilities they have to take. So certainly stress is an important risk factor. It could be a trigger, and we have to manage the stress. So we have to take care of 5 S actually, 5 or 6 S. What are those 5 or 6 S? One is stress, second is spirit, third is smoking, fourth is sedentary, and fifth is your sugar.
Okay. Right. Thank you, doctor. It's really an eye-opener to when you said that it's 8% of cases that you see amongst the younger ones are women. That brings to a very crucial question to Dr. Sanjay Mittal. Doctor, so if this is the statistics at some part of the part of the entire country, what are the main precautions that women should take to minimize cardiac health risks, doctor?
I appreciate what Dr. Manjunath just said. It's very important. And women are a very important part of our community. The problem is that we still have a big myth in our community, not only in our community, but world over, that women are immune to heart disease. Even till the time that they have menopause, as Dr. Manjunath said, yes, we have been seeing increasing incidence of heart attacks or heart deaths in women. The second problem is that women have a different kind of presentation. Many times it is not a classical chest discomfort, chest pain, sweating, jaw pain, and all. They actually have little vague kind of symptoms, more of nausea, vomiting, dyspepsia, tiredness, ghabrahat, which is not very well understood by even best of the physicians.
Okay.
The third thing is that people who actually are in younger age group of women, they have very uncommon presentation in the form of they have more frequent presentation at rest. Rest discomforts are commoner and more commonly after emotional stress. So
Okay.
they are more likely to present after emotional stress rather than physical exercise, as we have more common men.
Mm-hmm.
Finally, there is another difference between men and women, that the risk factors, the conventional risk factors of diabetes, obesity, and hypertension is different. They are common for both.
Okay.
But there are something which are very specific for women. They are more likely to misbehave if they are diabetics as compared to men. So if a lady is diabetic, it's going to be much worse because they are going to lose that protective effect of those sex hormones, female hormones, even earlier on. So they are becoming more vulnerable. The second thing is stress and depression. As Dr. Manjunath said, it's very important and prevalent in ladies, and this leads to an early atherosclerosis fat buildups. Smoking is much worse in ladies because this kills all the protective effect of those sex hormones, as I said, and much worse, and inactivity. All those things, as Dr. Manjunath also said, and Dr. Gopi also said, that inactivity is just like smoking. If you are inactive, you are just like smoking cigarettes. It's as much risk to the heart as you have smoked a cigarette. So inactivity is a big problem. But more importantly, obesity and the PCODs and menopause, early menopause, menarches, the menstrual irregularities, people, ladies who have these kind of problems should be watching their side much more carefully.
Okay.
We can do is a part Dr. Manjunath did mention, but no lady should be smoking because they usually smoke to equate men, for a kind of a sexual equality. But men should not smoke and women should never smoke because that's not good for their health, and not only for their health, but also their children's health, because in the womb also it causes problems. The second thing is they should always adhere to a healthy diet. They are good cooks, and most of the households today are dependent on women for their cooking, and they only cook for making all the family members eat better. So nutritious diet is something which is to be inculcated into the infrastructure of all women. Third is regular exercises to readdress and understanding that inactivity is much bigger a risk factor for a young woman as compared to a young man. So that is why we have to observe that. And as Dr. Manjunath was mentioning about the 5 S's, I would just reiterate on the first S. The stress is easy said to be mitigated by an individual. Don't take stress. But how do a person not take a stress? So there is a collective bearing of all the family members, a responsibility of all the family members, including the husbands, to take responsibility of the home household works, which is something which is lacking in India. And I was so enamored with Dr. Manjunath's statement when he said, women, even if they're working, they are going home, taking care of the children and the husbands, and there's no Sundays off, there's no Saturdays off, there's no weekend off. The time we consider is off day for us. We have been tired the whole day, whole week working, at least Sundays off. But that poor Sunday is a double work for that poor lady. So that working lady is a double whammy because they are stressed at the work and they are double stressed at even the holidays. So that is something which is why even if the best of the societies in the world you see, there is an equation of taking the household responsibilities by the husbands. And I think as a responsible citizens, it's our duty to actually help our mothers and our sisters to actually be better health and sustained health.
Right. Thank you so much, Doctor. I think both of you gave a clear picture on various aspects that affects someone for a heart condition and then how to overcome it. One last thing that I would ask Dr. Gopi is about, Doctor, recently even young adults adults and college are getting diagnosed with stress and hypertension. How to deal with this situation, and will it lead to an increase in number of people with cardiac complications?
Yeah, I think already we had enough, information given by Dr. Manjunath and Dr. Sanjay regarding the stress part. Like in a similar way, we have been seeing increased incidence of heart attacks in younger patients. Same way, hypertension also is been increasing in the youngster. There's almost a 20 to 30% increase in hypertension in the younger individuals. And we know that hypertension is the most common or the most important risk factor for developing heart attack and other heart ailments. It can result in multiple things. It could result in heart attacks because of blockage in the blood vessels. It increases the thickness of the heart muscle. As a result, the muscles tends to become weak and the pump failure. It can indirectly affect the kidney, resulting in renal kidney problems, eyes, stroke. So hypertension has a detrimental effect on almost all the major organs in the body. And in the younger patients, it's becoming more of a problem. And another thing is this asymptomatic patients don't come and tell you that I have hypertension. Unless they check for it, we will not know that they have hypertension. So they may be like a silent killer. So hypertension is a very, very important risk factor and leads on to multiple health issues. And unless we tackle it in a very aggressive way, all these patients who develop hypertension at a young age are going to land up in problems in future. So basic preventive measures are very, very important. Like regular exercises has already been alluded to. In the diet, a salt restricted diet is a very important thing. So basically we say do not add any additional salt on the table. Then high salt containing things like say pickles, papads, chips, salt biscuits, mixtures. These are all things which are notorious for having high salt content. And in cooking, whenever the person who cooks should be instructed that cook under put salt, lower range of normal. Salt has got a range. It's high normal, low normal. Always try and stick to what is low normal. And with these things and maintain an ideal body weight, these are the things that we can do to try and prevent blood pressure. And again, it runs in families. If our siblings, parents have it, we need to be extra cautious and keep a lookout for it. Try and catch it as early as possible and keep it under control so that the long-term deleterious effects can be prevented to a large extent.
Right. Thank you, Dr. Gopi. Of course, the entire fact that no salt on the table, no salt extra on the table is very valid point that you had made. Dr. Manjunath and all other doctors, for the last closing comments that I would come to, one last question was about, can environmental factors like pollution have an adverse effects on cardiac health, doctor?
Yeah, air pollution. Yeah. General understanding is air pollution causes only respiratory problems. It causes only lung infections and all.
Yes.
Or it can worsen asthma and all. But interestingly, air pollution is considered to be one of the important risk factors for cardiovascular disease, in particular heart attack. In India, last year, nearly 20 lakhs people have died because of air pollution. So particularly the particulate matter less than 2.5 microns, when we inhale that polluted air, they go through the lungs and lungs cannot filter those small particles. Then they get deposited in the blood vessel, resulting in clot formation and heart attack. So air pollution is considered to be a new public health problem. And not only it causes heart attack, it can cause abnormal heart rhythms. It can cause heart failure, particularly people who are already having a pre-existing heart disease. If they are exposed to air pollution, they can have more problems. And see, another interesting, important thing is we have done a study of on cardiovascular evaluation on some 5,000 BMTC workers who are basically drivers and all, and auto drivers, BMTC drivers. So in our study, nearly 15% were admitted in ICU for heart attack management are basically from this group where they are more exposed to air pollution. that is auto drivers and the bus drivers, because they are certainly air pollution is considered to be an emerging risk factor. Unquestionably, it is contributing to higher prevalence of heart attack. Now we are talking about soil pollution also. What is this soil pollution? We nowadays, you take anything, any vegetables or any fruits or any pulses and cereals, all are grown with pesticides and you use a lot of fertilizers. So there is, as a result, we are consuming lot of poison in micro quantities every day. So there is an interesting article on that. Soil pollution could also be an important risk factor. See, looking at this burden of cardiovascular disease in India, because burden of cardiovascular disease in India is quite huge. And also the prevalence of heart attack is occurring at an younger age group. Considering all these facts, so men above 35, women above 40 should undergo one medical checkup anniversary. That is, in this age group every year, that is blood pressure, blood sugar, and blood cholesterol. And if there are multiple risk factors, they should also undergo some treadmill ECG. See, there is a misconception in the society that cholesterol is high always in obese people and thin individuals, and underweight people will not have high cholesterol. That is wrong. There is no correlation between your blood cholesterol and your body weight. Somebody can be underweight, their cholesterol can be high. So just because they are underweight, they are thin, they should not assume that their cholesterol will be normal. Right. So finally, for your good heart health, 5 things you have to keep as low as possible. 5 things you have to keep as low as possible. One is blood pressure. Second is blood sugar. Third is blood cholesterol. Fourth is your body weight and waist circumference. Fifth is overambition, and overambition. I think that is how we should maintain your good heart health. And we should have a medical checkup anniversary above 35 for men, above 40 for women. And as already said, exercise should be regular and very, very important.
Thank you. Thank you. Yes, doctor. Yes, go ahead, please.
And fast food she should avoid.
Yes, I was coming to that point.
our younger people, see, you just go to any colleges where youngsters are eating a lot of pizzas, fries, and chips and all. And almost every attached to every college campus, there are all these eateries are there. So fast foods they should always avoid, and they are very much fascinated towards the fast food. What is the definition of fast food? The food that takes away your life very fast is the fast food. So I think they should have consumed more fruits, vegetables. See, in fact, interestingly, only 11% of Indians are eating adequate quantities of fruits and vegetables. You have to have more fruits, more vegetables, high fiber in the diet. And of course, red meat one should avoid, fish and chicken in limited quantities, and more of your pulses, sprouting pulses and all those things. And energy drinks also is maybe bad, high protein diet. Yeah, see, high protein, artificial high protein diet may be bad actually. There are some studies. So best natural proteins could be, egg could be a good natural protein, or even your sprouting pulses are good proteins. I think it is natural things are best for this health.
Right. And I also remember in a conversation with you also, you mentioned about how important it's a hot cooked food that people sell on the food carts are even better than the fast food that you were mentioning.
One should avoid this processed food, fried foods. And again, there are some, I think, WhatsApp circulations we have seen that everybody should undergo a CT coronary angiogram. So some people ask, we have heard in the social media that no, I think as a part of a general screening, there is no need for CT coronary angiogram. Those who have multiple risk factors, like their diabetes, hypertension, they are smokers, strong family history of heart attacks, such people can undergo a coronary calcium score. If the calcium score is high, then yes, they have to undergo further future tests. As a part of a general screening, it is not recommended.
Right. Thank you. Thank you so much, Doctor, for giving us this entire input. When it comes to food, Dr. Sanjay, this is something that I really wanted to ask you about. How some people are now saying the fats might be not the real thing that causes the heart health or affects the heart health, but it could be the carbohydrates that you take, is what has been told, Doctor. So, what is your take on this?
Yeah. So, Kumaran, this is important question. I would first like to comment on what Dr. Manjunath said a few minutes back. He did give us the 5 things which we have to watch for.
Right.
Let me give the 5 things how to watch those things out.
Right.
Point number 1 is find excuses to exercise. We have been discussing about that. Which by what means, by what excuse you could take 100 steps, 200 steps, whatever things is something which we have to be. That means data inactivity. Point number 2, the food you eat should be nutrition based, not taste based. So what I give people is tasty food only for tasting purposes, not for eating purposes. Because many a times, whatever is taste maker, whether it is sugar, whether it is salt, or whether it is fried, is all the vice which can lead to increased chances of coronary artery disease. So tasting food, yes, important, but only for tasting purposes. Point number 3 is no to smoking. There's absolutely no tobacco in our armamentarium.
Okay.
Point number 4 is learn to beat stress. Stress is a part of life and we have to take it. And point number 5, regular checkups, specifically if you have a family history. So for those 3 things which Dr. Manjunath did mention about. Now, coming on to your question of carbohydrates.
Yeah.
There is no second thought about it. You know, your body designed is not to recognize fat from sugars. Whatever you eat as calories is going to be dissected out into microglobules of either fatty acids and glycerol and glucose and other things. And this is going to go into the liver. And the liver's job is to reconstruct everything, extra calorie, and convert everything into a fat, a cholesterol, and that's how it is stored. So the storage house of extra energy in your body is cholesterol. If you take high amount of carbohydrates, the problem is the carbohydrate absorption and digestion is 100%. As soon as you take, it goes into the stomach and gets absorbed completely. And the insulin is responsible for taking care of the glucose, which is there into the blood and convert them into the cells, into the cholesterol. So the cholesterol synthesis is more frequent by the carbohydrates. You want to lose weight, you have to first cut down on your carbohydrates. You want to reduce your belly fat, carbohydrates are the culprit. And if you want to lower your cholesterol, it's been very clear, high carbohydrate intake leads to higher circulating LDL cholesterol as well. And lower HDL, the good cholesterol goes down. So this is absolutely true. The other thing is, I disagree with when you said that fat is not important. Because fat is an important component of your calories. As Dr. Manjunath said, if you take fried food, which I disagree with Dr. Manjunath when he said fast food. To my opinion, the fried food is much worse off because it contains much more amount of trans fats, which are the worst amount of fats in our diet. If our diet contains high amount of unsaturated fats, it is good. Say nuts, say eggs, the white of egg at all. So those are a few things which you can actually take in abundance because it actually gives you good types of cholesterol. HDL cholesterol goes up. And HDL is responsible for reducing the bad cholesterol levels. So if you take more saturated fats, which include in fried stuff, butters, and the hardened fats at all, those things have to be best avoided. But yes, we have to watch our calories, and the biggest source of the calories is carbohydrates. Carbohydrates are much more dangerous than the fat, but fat also in fried form has to definitely be avoided, fast foods and fried foods.
Right. Thank you so much, Doctor. Rightly put that fat is not the real villain. Maybe carbohydrates is the real villain. Good for the heart health. To sum it up with the Dr. Gopi's question, Doctor, so listening to after all these inputs that you have given, in fact, is it time to tackle cardiovascular health as a community health issue by our policymakers? Is there a need for better awareness among the people, especially from school level itself, to ensure they adopt a heart-friendly lifestyle and avoid complications in the
See, I
future?
think, yeah. See, we know that cardiovascular disease is the major killer in the world.
Right.
30% of all deaths happen because of cardiovascular illness. Now,
Right.
we have national, prevention programs for, or treatment program for tuberculosis, malaria. I mean, they're all important infective disease which can be cured. But I think the fact that this is the major killer obviously means that we need to have definite, national control programs or national education programs to tackle this, because whatever we do in the hospitals treating patients is not going to affect the community in a large way in terms of prevention. Prevention has to start in each household, in each kitchen,
Wow.
in each living room. And for this, it can only happen if people are aware of what are their risk factors, what they can do. And we know that these risk factors set in from childhood. So from the womb, if you have a low malnourished fetus, in them they say heart disease. So it is a full cycle from birth till the person is
Right.
alive. There are always risk factors which are kicking in. So unless people are aware of what they can do, like let us say exercise, I think it has been extensively mentioned about what sort of exercises, how much of exercises, diet in terms of salt, control of diabetes, good amount of fruit. So all these things, unless they're educated to the public, they will not be aware of it. Second thing is, we find that in our country, when people present with heart attacks, they reach the hospital much later than what is seen in the West. That is because they're not
Exactly. Yeah.
aware of what are the symptoms of a heart attack. So we should, again, education is the most important. When to suspect that this may be a cardiac problem. It may not be gastric problem. As many times they say gastric, I thought it was gastric, and they come one day later. So a lot of heart muscle gets damaged. There's a term called as time is muscle. The
Okay.
moment there is a delay in the heart getting the blood supply during heart attack, muscle gets damaged. So the earlier they come to they reach the hospital, we can treat them much more effectively, get their heart, preserved much more, and as a result, preserve life. So I think it is very, very crucial that our politicians and policymakers bring out national education programs, awareness programs, so that public are aware of what they're dealing with, when to reach a doctor, what the preventive measure that they need to take. Thank you.
Okay. So when you also to little bit continue with this particular question, doctor. So when you say this, there's also one of our attendees have asked this particular question, that should youngsters take a CT angio as part of their health checkup? And definitely, Dr. Manjunath has said that it is not required. So as another interventional cardiologist, what do you have your opinion on, doctor?
No, I think, yeah, I perfectly agree with Dr. Manjunath. There's a statement that CT coronary angiogram should not be a routine screening method. In a given patient where a CT calcium score is high or has got other multiple risk factors, in them a CT angiogram is okay to be done as a screening, but otherwise as a routine, I think, because that has got its own things. You're being getting exposed to radiation, exposed to contrast. So all these things repeatedly would not be good for the health in the long term. In a
Okay.
sub-segment, so I would not really encourage people to walk in and tell that I get a CT angiogram done for me. If it's been
Okay.
prescribed by a doctor, yes, I think it should be done. Otherwise, it should not be done.
Okay, right. Thank you so much, Doctor. Dr. Sanjay, I think one last question that I think you have wanted to answer this particular question from our audience. Unlike cancer and diabetes, when there is more awareness about early screening, most people wake up to cardiac checking and heart health only when they are close to their 30s. Do you think there is a need for an early screening for cardiac conditions?
For sure. So two things which I want to reiterate. Cancer still have a short shelf life. If you develop or detect signs of cancer today, you would possibly have a short life. That means within a few months or so much, that things are going to go out of hand.
Yeah.
And so the detection is too close to the event. But for coronary artery disease, as all of us three have been reiterating, the disease actually starts decades earlier. And by the time we don't realize that it could be so disastrous. 30% of the mortality in the world and in our country are because of the cardiovascular diseases, as very rightly put. So the other thing is, yes, we can go earlier, but earlier in not all. We cannot start all the children to actually go to testing. The first thing is there are certain people, everybody of us, like Dr. Gopi said, should be inculcating good lifestyle, because lifestyle correction at early lifestyle and maintaining that through the middle age is the mantra. But second thing is there are people who are vulnerable. And those people are those who belong to very young heart attacks in the families. And in those people families, we can actually do the early testing. Today, we have even polygenic score and other genetic markers, which can be done even in children. The hypercholesterolemia, which is there usually representing early in childhood, and early diabetes, all those things can be actually detected much earlier, so that we can dissect out which is the group of population where the lifestyle measures have to be very stringently adhered to. So that is something. If we make a mantra that everybody has to adhere to a good lifestyle, then the earlier checking may not be so much required. Yes, in very vulnerable population, we have genetic testing, we have polygenic scores and other markers which can detect early distortion of lipids, sugars, and other vulnerabilities and correct them.
Right. Thank you so much, Doctor. Very well put. I think we have come to a conclusion of how each and every person has to take care of his heart or her heart, and how importance to women. And as Dr. Gopi also was telling about the entire lifestyle, the way you take your lifestyle is very important to how 8% of women, what Dr. Manjunath said was alarming. And of course, as Dr. Sanjay Mittal also pointed out, that women need to take care of your heart as well, more than taking care of the entire family. Thank you so much, Dr. C.N. Manjunath, Dr. A. Gopi, Dr. Sanjay Mittal, for joining us for this wonderful and interactive session. And thank you so much for joining. Thank you.
Thank you, Dr. Gopi, Dr. Sanjay.
Thank you, sir.
Thank you, Dr. Manju, Dr. Gopi.
Bye.